Hello, my name is Dr. Vin Gupta. I'm a practicing pulmonologist and an NBC medical analyst.
I'm Erika Edwards. I'm a health reporter with NBC News, and today we're going to talk about how to produce a medical news story.
We live in an age right now where you, as the medical beat reporter, are going to be faced with a litany of pitches in your inbox.
There is a lot of noise when it comes to press releases, pharmaceutical companies, even hospitals are trying to push their new, robotic surgery or something like that.
Is a press release that you're seeing from a major pharmaceutical company who tends to do science by press release, is what they're talking about, is that going to impact a large denominator of people that are going to be hearing about this story?
There's a lot. You can be sure that a lot of people are going to read it. A lot of people will see it and learn from it. If that's not the case, it's finding that really interesting nugget about how it helped one person that's very compelling to the rest of us. The first person to be cured of HIV, for example. That hasn't really translated into widespread cures, but those little increments of science are very important to talk about.
Big picture, what should folks know and what don't we know about daily use?
Well, so Chris, thank you for highlighting this.
So what matters to keep your health segment as approachable and as understandable as possible for your end viewer or your reader? Often there's a sea of information. Lean into visuals. The most complicated medical topics are amenable to some sort of visual or graphical presentation that can help convey your point.
Our data graphics team, they're able to take some of that really complicated math and put it in a beautiful map or a graphic that's really easily digestible to anyone reading or watching the story.
Visuals have been very underutilized, especially covering the pandemic, in conveying complexity and breaking down complexity in a way that is really understandable.
The other thing is what will be visual about this story. When we get into a lab, what are we going to see in the lab? When analyzing what mosquitoes cause West Nile, what are we going to see? Are we going to be able to put our hands in the cage? Are we going to be able to see little Johnny actually taking his medication? The other thing that's really important in medical journalism is to identify the characters.
Leaning into patient testimonials, identifying somebody who might be willing to tell their story.
Identify the patients or the families who have been in the hospital or have had a disease so they can really talk in plain language. What was it like to go through chemotherapy? What kind of feelings did you have? And that's really how we can sort of break through. You're my hero.
Really profiling patient testimonials. Bringing that forward is going to go a long way towards the most important element here, which is engagement. How do we get people to actually care about what we're talking about? To listen, to stop what they're doing, turn up the volume, and really lean in. And part of that is storytelling. I'm like that person who's on the screen. Oh gosh, I went through that. It's a clever, creative, and nuanced way to get home a point.
The other thing that's really important is to find the right expert voices. You can't rely on just one doctor and her patient to tell a story. That's where it really comes in, where you talk with, even on background, 3, 4, 5 doctors from around the country, experts who have nothing to do with this new therapy or this new treatment, so they can give you that extra guidance. I never want to rely just on what one person tells me. It has to be replicated across the country with other doctors.
Set that expert up for success. Make sure that you do everything you can in B-roll and within the setting of the interview to position them as an expert. Optics matter. Have them wear a white coat. Try to get them in the element of caring for patients. Make sure that the viewer, when listening to what that expert is talking about, trusts them. I often work with segment producers 30, 40 minutes sometimes before I do a broadcast segment to make sure that we have the right elements in place, whether it's a list, whether it's a set of graphics, a picture, to do what's often hard to do in words, which is how do I convey complexity quickly, easily, succinctly? That's where you want to lean in.
Dr. Gupta, thank you for joining us.
One of the most maddening things about being a health journalist is that last week I told you that coffee is going to kill you. This week I'm going to tell you that it's going to cure all of your ailments.
Be very careful about taking the bait on those types of stories.
You find these contradictory studies that come out, and after a while it makes you feel like an idiot because it makes you seem like you don't know what you're talking about, or that scientists don't know what they're talking about.
These are stories talking about very consumer-focused angles that, in theory, check the box of impact. What I would not do is respond to the pitch in the email coming from a specific manufacturer of a product claiming efficacy of a certain amount in the absence of peer-reviewed research backing that up.
It's just important to look at what they found and then back it up with all those caveats.
If you're not seeing a peer-reviewed citation, pick up the phone and phone a friend. It's critical, especially for those that don't have a healthcare background, to get it right.
Give that sort of historical perspective. You can't just rely on the latest and greatest headline. That's why it's so important to understand what other research has found and to provide that context to the viewer. To be honest, I've stopped covering studies that tell you 1 week coffee is going to cure cancer and the next week it's going to kill you, because I find that going back and forth so often sort of undermines my credibility. And a lot of times when you look at those studies, you'll find holes in them. You'll find that you're taking too much time explaining what the history is and not enough time really just telling people what they really need to know, which is use things in moderation and talk to your own doctor.
Erika, good morning. So what else are doctors saying about why it's harder to diagnose COVID right now?
There's such a gap here in trustworthy medical information. That's where we're bridging now. Health journalism as a service, when done properly, when done with the right expert voices, when focused on issues that matter. If you can get those elements right, you can build trust and understanding. Well, gosh, you might actually impact somebody's life.